Hi, my name is Dr. Jenna Dye. I'm a naturopathic physician at ALETRIS Center of Integrative Medicine in Scottsdale, Arizona, and I focus on pediatric medicine. I'm going to talk about a subject that comes up with my patients quite often, and that's food allergies. Many of us are affected by food allergies or sensitivities, and our little patients are especially susceptible as their digestive systems and immune systems are sensitive and still developing. Oftentimes with chronic food allergies, I'll see symptoms in children such as skin conditions, behavioral or learning conditions. I'll also see frequent colds, frequent ear infections, and even constipation. At ALETRIS, we believe that nutrition is a key ingredient to your child's immunity. And if your child is presenting with these chronic conditions, we may suggest food allergy sensitivity testing. There are two types of food allergies I'm going to talk about. The first type of food allergy is a type 1 reaction, or what's called an IgE reaction. This is a reaction that happens immediately. This can happen within minutes of ingesting or being exposed to a food allergen. Oftentimes people will present with this type of allergen as a breakout in hives or difficulty breathing. Again, this happens immediately. And oftentimes we know what foods are the triggers and we can stay away from them, and that's because of this immediate response. The second type of reaction is what we call a type 2 reaction or an IgG reaction. This one's a little more difficult. With this one, it's a delayed reaction. This one can happen within a few hours to even days. It takes the body a little while to actually mount a response. Oftentimes these responses are not as severe as those in a type 1 reaction. However, over time, depending on how our body breaks it down, it can develop into toxins in the body. That can add to stress on the immune system. That's where we see conditions such as skin conditions in children. An example would be eczema or psoriasis. We can see chronic constipation or other digestive issues. Learning and behavioral issues may arise from these toxins, and even frequent ear infections, common colds, and just a general lowered immunity. Again, this is a type 2 response and it's a delayed reaction. At ALETRIS, it is our job to treat your child as an individual. If your child is coming in with these chronic symptoms, we may suggest some type of food allergy protocol. Sometimes we'll start with eliminating possible foods that may be causing these food allergies by doing an elimination protocol. We may further that with actually adding a specific allergy test. When we do a specific allergy test, we test for that type 2 reaction, that IgG reaction. The reason we do this is because this is difficult to pinpoint because of its delayed response. So we'll test those foods, and when we receive those results, we can then properly eliminate those foods that are causing the allergens. This is very important, especially with these chronic conditions. It is our job to educate you as a parent and to encourage your child to be involved in these proper food choices. We also, at the same time, we're going to do naturopathic treatments. We're going to strengthen your child's immunity and their digestive system. Our little patients respond very quickly to naturopathic medicine, especially when we're dealing with food allergies and food sensitivities. Our goal is to treat the cause of your child's symptoms, and this is one avenue in which we can accomplish this.